Okay, so let's say you have a patient who is complaining of pain, discomfort, especially when they bite down. The tooth had received an endodontic treatment, and so you're kind of wondering if there is a root fracture. Well, you can test the patient clinically, or you can try to look at it using the CT scan. If we're going to look at it using the CT scan, you could do it the way I've taught you before. So basically, you're creating the panoramic curve, and this is all review for you. And so you just basically create a curve, no different than you would as if you were doing an implant treatment. Double click, and there you have it. And in this particular scenario, the patient is experiencing pain, let's say at the 46 area. And so you go to the 46 area, and you can look at the sectional slices above, and you can actually see, indeed, is there a fracture, and you can look for radiolucencies. Sometimes you will see a radiolucency between the lingual wall, lingual bone and the tooth, or between the buccal bone and the tooth. And if you use your scroller in the sectional areas, you can move it ever so slowly, and you can evaluate the teeth in question. But if you look at this, if you notice, when you're looking at the sectional slice this way, you don't always have the benefit of looking at each root individually. Sometimes you have to just look at slices of that root at an oblique angle, just like I'm doing here. So as I'm scrolling my my mouse on the sectional slice, I'm going through different layers, but you'll notice I'm looking at the root kind of in an oblique fashion. Another way of looking at it is actually go back to the original view, which we call the MPR view. Okay, and this is tooth number 46 right here. So what I do, another way of doing it is to take this crosshairs and move it, let's say, to the mesial buccal of the 46. Okay, I think this is the 46. Yeah. Okay, and now if you look closely, you'll go, well, wait a second, this is off angle and this is off angle. So what you can do is you can use the twisty-turny thing and change the pitch of the evaluation site. So now you're looking at the root dead on. Okay, so I just changed the pitch so that we are looking at this root dead on. Now, of course, if you look at that, you go, well, that's nice. However, it's kind of small, so you magnify it. You go to the very left, you click on the magnifying glass, and you click single. And then when you go to this area, you click on it, hold down the left mouse, and slide it forward. There you go. Okay? And then you can do the same thing on this one. Click on the left mouse and slide it forward. All right. You can also look at this orientation and go, well, this isn't exactly what I want to see first, so let's see if we can straighten this out for us too. So take the twisty-turny thing, and I'm just going to change the angulation slightly. Good. All right. And now I have a good clean line view of this root, clean line view this way. And what I do is I go to the axial view, grab the twisty-turny thing, and I start rotating it around, pivoting it around the axis, around in the axial view. And if you look on the very right, you can actually get to see the whole tooth. Now you're in this particular scenario right over here, you can actually see the mesiobuccal and the mesiolingual obturation, endodontic obturation. And if there was a fracture, you would usually see a darkness associated with it right in the interligament, in the ligament space. Okay, that's what you would notice. If that's a start of a fracture, you would see almost like a blip. If you had a long fracture, a fracture that had been going on for a long time, you would actually see almost like a cavern, like a little oblique or diagonal bone loss right here. And usually it would start at the fracture line and you would see that diagonal bone loss. So that's how you would diagnose fractures. I hope this helps you. Again, this is more of an advanced thing. You have to spend time figuring out the software, but if you're interested, you can play around with it. And of course, you're looking at each root at a time. Let's say if I wanted to look at let's reset this. Reset all. Yes. Okay, let's say if I wanted to look at the distal root, I would take the crosshairs, go to the distal root right here. I'm doing the same thing as I did earlier. Take my crosshair, take my pitch, adjust my pitch so that's in line with the tooth. I can take this one, adjust my pitch so I'm in line with the tooth. Great. I can magnify, zoom, single, grab it and zoom in, grab this and roll it forward, left click and push. Okay, and then now I go back to my pointer, click on the twisty turny icon and spin around this distal root. And now if you look at either the top coronal view or the sagittal view, you can have a very clear shot of this root, and you're basically spinning around this root in a 360 degrees, and what you're looking for is either a fracture or an oblique bone loss or a blip of bone loss. Okay, and so this is another way of determining fracture in the root.